Hey guys, it's Gianna, Midwifay. Welcome back to my channel. Today, in the next installment of my Informed Pregnancy series is, oh my gosh, I have a positive pregnancy test. What do I do now? We're going to talk all about early pregnancy symptoms, what to do once you get pregnant, what next steps are, and go through everything. All right, let's get into it.
Always, I want to encourage you, please like this video, subscribe to the channel. It really helps me know which videos you guys like and what other content you want. So please go ahead and like and subscribe if you haven't already.
Okay, so let's backtrack a little bit, okay, on taking the pregnancy test, right? In my first video, we talked about thinking of getting pregnant, steps to consider before getting pregnant. If you're not one of those magical unicorn people that was able to plan this pregnancy, you didn't quite know, let's talk about taking a pregnancy test. When do you do it? It is recommended to take a pregnancy test a few days after you expect a period and you have a missed period, okay? So at-home pregnancy tests these days are a lot more accurate than when they were 10, 20, 30 years ago. However, it's still best to wait, if you can, until your missed period date instead of taking it days sooner. I know, it's hard, especially if you're trying to get pregnant, to wait, and these tests say 5 days before, 6 days before your missed period, you can find out. And although that could be true, it's best and most accurate for you to wait until the day of your missed period, and better yet, a couple days after if you're able to. So now that you've got your positive pregnancy test, what now, right? Like, what a wild change that you're about to experience. So you've got a pregnancy test, likely a couple positive pregnancy tests. What do you do now? Well, the first thing is you take a deep breath, you smile inside, and you start to get excited. Start to thank your body for the changes it's going to go through and the miracle it's about to experience in pregnancy and childbirth. Almost immediately after that, probably what you're going to be thinking is, oh my gosh, what do I do? Do I call a doctor? What do I need to do? Listen, sis, what you're going to do now is you're going to contact your provider, okay? I recommend you contact whoever you're most comfortable with. Hopefully, if you watch my preconception video, you've established care with an OB provider or primary care provider that you had that preconception visit with. They knew you were trying to get pregnant. Now you're pregnant and we can move forward. What you're going to do is you're going to call the office and say you've had a positive home pregnancy test, and they're going to get you scheduled for an appointment. If you didn't have a preconception visit or didn't plan this pregnancy and didn't, have anyone to contact, you can start by calling your insurance. The number on the back of your insurance card, you can call that customer service number and ask for OB providers in your area. I'll have some websites in the description down below too, where you can search online for OB providers. You can use different community groups to ask local moms, ask friends who they've used for OB care. So lots of different ways to find a provider, but I recommend if you have someone that you're comfortable with, even if they're not OB specific, you can still go to a family practice doctor, primary care, and internal medicine doctor to do your initial parts of your prenatal care before choosing where you want to go for prenatal care. When you call and make the appointment, likely they're going to set up what's called a pregnancy confirmation appointment, okay? This is done anywhere between 6 to 8 weeks or so of pregnancy. This is where the doctor's office, specifically if it's an OB's office, will do their own urine pregnancy test on you. They likely will have you meet with one of their nurses or a medical assistant, sometimes even a midwife, to discuss pregnancy, what you can expect, to go through a lot of those health history questions that if you did not have a preconception visit, they'll be able to talk to you about then. So it's more of a discussion interview than a medical appointment, okay? That's what they're going to likely schedule you for when you call. It's called a pregnancy confirmation appointment. Now, in between today, your positive pregnancy test, and that pregnancy confirmation appointment, which I said is somewhere between 5, 6, 8 weeks of pregnancy, what are you doing, right? You're continuing to do those things that we discussed in the last video, optimizing your health. You're continuing to, obviously now, refrain from alcohol, refrain from smoking, caffeine use, cutting it back, decreasing it, avoiding it altogether. Keeping up with your exercise routine, whatever your mental health routine is, you're making sure that you are being the best physical, emotional self that you can for this growing tiny baby in there. Some things you may experience in these super early weeks of pregnancy are like pelvic pressure, some slight cramping. It might be like menstrual-like cramping. Should not be regular, super painful, uncomfortable to where you can't walk, sit, or stand. But often people report feeling some cramping, some tightening, some twinging down in their lower pelvis area, and that can be normal, okay? You might experience some spotting, a little bit more concerning, but also could be possibly normal. When I say spotting, I truly mean light spotting, okay? Usually brown or maybe pink. If you see anything bright red, I wouldn't want you to think that that was normal, and you would want to go to the emergency room for that. Other things you may be experiencing in these early weeks, you know, it's a little early to experience the true first trimester symptoms that come from the hormones, but you might just be experiencing fatigue, right? Just general fatigue, malaise as they call it, just not wanting to get up and do anything. That could be happening during these early weeks. More commonly what you're experiencing is excitement and anxiety. Just continued excitement about what's going on. You know, we live in this westernized, rushed society where we get all the information at our fingertips. We can Google everything, and that's great. This is one of those areas still, though, where we can't control everything, and nor do we know what's going on at all times, especially in this early pregnancy time before you've seen an ultrasound, before you've had any labs done. It's really this time of what's going on in there, I just don't know. And it's super common to experience the excitement of it as well as the anxiety of it during that time. So that's why I find it's really important to be working on whatever your mental health plan is, staying with your regular therapy, having open communication with you, your partner, your family, your support system, whatever it is, open communication about the things you're feeling, the things you're experiencing, especially if you've had a previous pregnancy that had a complication or ended in an early loss, right? Like really making sure you're being really communicative about the things that you're experiencing during this time when there's not much you can do other than optimize your health, continue with your mental health plan, and keep building excitement about this little baby that's just starting to grow. All right, I hope this video helped now that you just peed on a stick. What a weird thing to do, to tell you that you're pregnant. And hopefully this gave you some information and some guidance on the small little next steps that you can expect before moving into your first trimester of pregnancy. Again, if you didn't watch the last video on preconception visit, please look at that and be ready for the next video talking about the first trimester and everything you can expect. And lastly, please be sure to check out my new course, Pregnancy Informed, once it becomes available in March of 2023. I'll have the link in the description below. I'm so excited to share this with you all so that you can be empowered, informed, and supported throughout your whole pregnancy journey and while you're navigating the complex maternity system here in the U.S. hospitals. All right, I will see you next time. Bye-bye.